Good morning. My name is Seth Doyle. I'm the Director of Strategic Initiatives at Northwest Regional Primary Care Association. And on behalf of NWRPCA, the National Center for Farmworker Health, and the North Carolina Community Health Center Association, welcome to Day 2 of our virtual forum for migrants and community health. We're so glad to have you join us today and throughout the week. We got off to an energizing start yesterday with some great presentations from our federal partners at the Bureau of Primary Health Care, the Centers for Disease Control and Prevention, as well as several great breakout sessions throughout the day. We have an exciting day planned today, beginning with our opening plenary now, with our morning plenary. Shortly, we'll be hearing from our colleague at the National Association of Community Health Centers, Rachel Gonzales-Hanson, and also from our keynote speaker, Maria Hinojosa. Before getting started with this morning's program, I have just a few brief housekeeping announcements to make. First, your lines will be muted throughout the presentation. If you do have any questions or comments that you would like to pose to the speakers, please use the Q&A feature on the right-hand side of your screen. You should be able to see that. Questions will be addressed during the Q&A portion of today's agenda. Second, today's session is being recorded. It will be posted in our virtual forum learning vault, as well as in other spaces after the conference is over. If you'd like to listen to today's plenary in Spanish, please select the option in the session description on the landing page of the CVent site. And finally, the views expressed today are those of the invited speakers based on their professional experience and expertise. Now, I'd like to turn things over to my colleague, Maribel Montes de Oca, for some additional words of welcome and thanks.
Buenos días y tardes para algunos de ustedes, for some of you. I'm Maribel Montes de Oca, the Community Health Improvement Program Manager at the Northwest Regional Primary Care Association. It is un regalo to be here with you all in the presencia of colleagues who have kept us and our loved ones, our comunidad, safe, informed, healthy, hopeful, and have kept us inspired. You all are the corazón of our health centers. You're the corazón of our comunidad, and it is un regalo, un honor. Estamos at your service, at your servicio. So with that, we hope that together we can virtually celebrar, chismear, desahogar, and enjoy a virtual cafecito or two with you virtually. We wanted to extend our deepest agradecimiento, our deep gratitude this year more than ever for the support from our partners, sponsors, and the talented and committed presenters that you all saw in action. We'd like to thank our planning committee, colegas. If you didn't know, it took 3 different planning committees, the Midwest, Eastern, and Western Forum planning committees, to make this possible. And of course, the amazing staff that you all may have already met from the North Carolina CHC Association, North Carolina Farmworker Health, or National Center for Farmworker Health, and the Northwest Regional Primary Care Association. So mil gracias to our staff, our planning committees, for making this all possible. And of course, mil gracias to you all, our attendees, for making this possible. As you can see over here, I want to also give our shout out to our highlighted sponsors. We express appreciation to the generous support from our sponsors and exhibitors. Our champion sponsors, Community Health Ventures, Advocate Level, South Carolina Primary Care Association, and Central Valley Area Health Education Center. And for our friend level, AmeriGroup Washington and MHP Salud, and of course, many of the educational session sponsors. So please show your appreciation by visiting them at the booths and gaining some points to get some really great prizes. So with that, I'm going to pass it back over to Seth.
Thank you, Maribel. So now it's my pleasure to be able to introduce our first speaker this morning, Rachel Gonzales-Hanson. Excuse me, Rachel Gonzales-Hanson with the National Association. Excuse me. Pardon me. Rachel is with the National Association of Community Health Centers. She's the Senior Vice President for Western Operations. Prior to joining NAC, Rachel served as the CEO of Community Health Development Incorporated, Community Health Center in Uvalde, Texas. Rachel was one of the founding board members of that health center in 1983, and she had served as the CEO beginning in 1986. In addition to overseeing the health center's operations and significant growth, Rachel also has focused on improving access to affordable quality healthcare for people from all walks of life, including those from rural areas, agricultural workers, and veterans. In her more than 35 years working with community health centers, she has served as a board member for the Texas Association of Community Health Centers, including being elected to the officer positions of secretary, treasurer, vice president, and president. Rachel has also been an engaged member of the National Association of Community Health Centers, serving as various chair positions and committee assignments. Rachel was also the chair of the Agricultural Worker Health Committee when we launched the Ag Worker Access 2020 campaign. And in many ways, we owe Rachel a debt of gratitude for her inspiration and her leadership in helping the health center program nationally to increase access to care for migrant and seasonal agricultural workers. So with that, I'd like to introduce our colleague, Rachel.
Gracias, Seth. Muy amable. Buenos días a todos. I'm so honored to be with you today. And I really want to start by saying how much we appreciate all of the work that you do every day, not just for your health center, but also para los pacientes. Estamos muy agradecidos. Next slide, please. So I want to start with a little bit of a celebration, celebrando que César Chávez sigue guiando nuestra gente. In case you haven't heard, President Biden has a sculpting of César Chávez in the Oval Office. So quite honestly, I think César's going to keep an eye on how things are done in the Oval Office. And that makes me feel pretty good about things right now. Next slide, please. So I know we heard quite a bit yesterday from Jim McCray about the COVID vaccine program and the health centers receiving direct shipments. Qué orgullo estar en esta posición. Y al mismo tiempo, es una responsabilidad muy grande. We have to deliver, we have to step up, but you know how to reach the most vulnerable populations and our beloved ag workers, right? You know all that. And all of you are part of the solution. And we are one big familia, so we're ready for this. But I want us to keep a few things in mind. Having health centers be in the spotlight is not by accident, and it didn't happen overnight. It has taken almost 60 years of building relationships and collaborations, strengthening health centers, fighting to make sure that we protect the law requiring health centers to have 51% of board members to be patients. You know, this year, NACHC celebrates its 50th anniversary. Back then, some very smart people realized that we needed a national organization to help us advocate for what we needed. And a few years later, NACHC realized that every state also needed an association because there were things at the state level that affected health centers. So after all this time, we are in a position where they are asking health centers to help the country through a pandemic. We are in a new era for health centers, and I am excited to see where your leadership, your commitment, and your corazón takes our movement. Next slide, please. Let's talk a little bit about the Ag Worker Access campaign, and Jim McCray talked about it as well yesterday, and Seth was so kind earlier to give me credit, but you know what? The credit is to all of us, to every single last one of us. You know, one of the most important things we can do is to ensure that every agricultural worker family has access to quality health care. And health center staff, just like you, are key to making that happen. For almost 60 years, migrant health centers have been focused just on this. But unfortunately, we may not have been doing the best job. Now, I'm the first one to say health centers are the best, but sometimes we need to admit when we're falling just a little bit short, right? As we reviewed the health center data over the number of years, the agricultural workers that we were serving, that number was going down, and it was concerning to us. It kept going down. We realized a couple of things were happening, though. First of all, I think health centers were not accurately capturing and identifying the patients that were agricultural worker families. And we really needed to do a better job of reaching out to those families and to let them know about our services. Se necesitaba una campaña to create awareness about the situation and find a way to do our jobs better. Así empezó nuestra campaña. Next slide, please. So the national campaign is being guided by a task force composed of representatives from health centers, primary care associations, and other organizations that provide services to the ag worker families. For example, Migrant Seasonal Head Start, the Migrant Ed Program, Housing Program, and a few others. Do you know why we have so many task force members from different organizations? Because this is more than about health centers. It takes a village to take care of agricultural workers. And we work better when we're collaborating, when we're sharing ideas, sharing resources, brainstorming solutions, building those relationships con otra gente de corazón, with other people that believe in our mission. Next slide, please. We have 4 focus areas for the campaign, and you can see them there. We need to understand that what the healthcare needs are for the ag worker families and what are the barriers for them to access those. We need to be sharing across our health centers all of those wonderful practices and the information that will help us do better. We need to be training our staff and educating our programs to other people, right? Other programs that serve agricultural workers. We've got to strengthen our partnerships and coalitions at every level. And that's probably one of the most important pieces. On the next slide, we can actually see where we are at. And Jim mentioned it, so he stole my thunder, but that's okay. He's entitled, right? Because he is who he is. But our goal was to be able to serve 2 million agricultural workers at least. We're more than halfway there. We just barely squeaked by in 2019. But we have a lot of work to do. Hay que celebrar, pero hay que seguir adelante. And we are definitely going to need you to do all of this. And on the next slide, it actually gives you the link to be able to sign up. So we need for you to visit our webpage, visit the campaign webpage and learn more about it. Join your other colleagues and all of the other advocates that are supporting this special population to be part of this initiative. It also has the latest information on tools and educational opportunities. For example, I want to let you know that we are planning a 3-part webinar series for health centers to learn how state monitor advocates and health centers can collaborate to serve agricultural workers. And if you don't know about state monitor advocates, then you're exactly the one that needs to sign up for these webinars. So let's make sure that we get it all, get all this information to you, and we look forward for you to checking it out. Let's go on to the next slide, and I want to talk a little bit about NACHC policy priorities, and we're going to go ahead and move forward. I want to be mindful of time because I'm so excited about Maria Hinojosa coming up next. So let's talk a little bit about where we have been since the election. You know, NACHC was very deliberate in talks with the Biden transition team from the beginning. We knew there would be a lot of people knocking on that president-elect's door, and we did not want him to forget that he promised to double the number, to double actually the federal investment in the health center program. That's a huge promise, right? So now we need to make sure that we're there to help him deliver on that. At the same time, we were working with Congress to get the resources that health centers needed to not only survive COVID, because we all struggled, but also to prepare for the future. Health centers need stable funding. We can't continue to be functioning the way we have been. So we were so happy in December when Congress finally passed a 3-year reauthorization of the Community Health Center Fund, as well as extensions of the National Health Service Corps and the Teaching Health Center Program. That was really needed at that time. On the next slide, it has a little bit more information about the American Rescue Plan. Now, this was passed by Congress and it's in law, so that's wonderful. It's a significant investment for health centers, and it gave us flexibility on how best to use it. That is what health centers had been asking for. Every health center is at different levels of capacity, and they are the ones that are in the best position to determine how to best use these funds. These appropriations are going to help with some of that information and some of those services that we need to be doing. On the next slide, there's a lot more information. And as you can see, there was a huge investment in workforce programs as well as for more COVID resources. So guess what? Now we are in a prime position to take advantage of these programs, and we need to be prepared to move quickly because Jim and company are going to try to get those grants out as soon as possible, and we need to be ready to respond to those requests for information. So I'm going to go to the next slide, and there you can see that we have a huge list, really, of resources that we still need to stabilize our infrastructure to help us plan for the future. And even though we've received quite a bit of resources here, as I mentioned, we still need to be very mindful that we're not anywhere where we need to be. We went through a tough year last year. All health centers did, and the PCAs and NAC. And we need to make sure that we're stable, right? We need to make sure that they get stabilized so that we can continue forward. On the next slide, I want to let you, this sort of gives you a summary, and unfortunately, we're not going to have time to review in detail all of the next few slides, but you will have access to these slides as part of your handout. So you'll be able to see all the specific information. And so each of the priorities are there and what we are asking Congress to do, and we need your help with this. So on the next slide, I'm going to show you just one example of what the rest look like. You can see that it gives you, I'm sorry, we've moved a little bit too far on the slides. So I need you to please go back to slide 15. Okay, great. Oh, 15. There you go. All right, we're cool. So this gives you a little bit of the background and then the ask, right? This will be the case for the rest of the slides as well. Please take the time to look at all of those after the conference. Talk to your health center leadership and your board members and your patients about how everyone should be contacting their members of Congress to ask support for these priorities. So now we're going to fast forward to slide 20, okay? And let's talk a little bit about the public charge rule. So we are excited, and you probably have heard, that the Biden administration dismissed the public charge rule that was put in place by the previous administration. This came about largely because of the diverse coalition of immigrant rights, healthcare, public health, and various community-based organizations working to get the rule blocked. We're hopeful that this will begin to ease the devastating effect of the last few years. Si Dios quiere, right? And I would like to also point out that changes like this happen as a result of relationships and speaking with one united and very loud voice. On the next slide, we have some more news hot off the press, right? Had some really good news late last week. The American Dream and Promise Act, as well as the Farm Workforce Modernization Act, passed in the House. And if anyone is here from Illinois, and I bet we do have, because Maribel, I understand that we have a lot of people in the audience. If we have anybody from Illinois, please take a few minutes to thank Senator Dick Durbin, who is the Democrat from Illinois, the majority whip. He was very instrumental in helping this to happen. So we need to make sure that we thank him. Now, that's the great news. The little bit of a bad news is that unfortunately, right now, he is saying that it will be very difficult for this fight to go forward in the Senate. Now, it's an uphill battle, yes, but if we've learned anything over the years, what have we learned? Que sí se puede y que sigue la lucha. So we're hopeful. So let's talk about, on the next slide, let's talk about how we can make all of this happen, right? All of the information I have been sharing with you leads to this final section of the presentation. And it's about doing what we have done for over 60 years to get us to this point. But it is about doing it in a more concerted way, using all the resources that we have to do it better, to do it so well that decision makers cannot ignore us. It's about advocacy. Tenemos que ser los defensores de los centros de salud. Health centers are at this point in history because we know that este es un movimiento. It is a health center movement, and we are in it for the long haul. Next slide. It gives you some information that you need to understand, and it will help you because our communities have a lot to lose. Whether we are talking to conservative or liberal elected officials, our messages must be heard, and we need to make sure that we give them the message, the right messages. On the next slide, I want to impart on you that it is also important for us to help our staff and our communities understand that they have the power to hold elected officials accountable for their support. And voting is how we do just that. Imagínense, health centers serve over 30 million patients. So what, can we assume that at least half of them are adults? Well, what if they all registered to vote? And then what if they all voted? Now, that is what Dolores Huerta calls people power. On the next slide, NAC has a lot of tools to help the staff to mobilize our communities. We have the ACE program, the Advocacy Center of Excellence program, as well as the ACE program, which is the Hispanic Advocacy Center of Excellence program. And you can just log on to our website and you can see all of those details to be able to get that reconocimiento, right? You can be designated as a health center advocacy, an advocacy center of excellence. It's very easy. And I have to share with you, a lot of the things that you're required to do, you're already doing it. Let's go to the next slide really quick. Obviously, we're on Facebook and Twitter and all of those social medias that I haven't gotten on all of them on, but I guess I need to, right? Otherwise, I'm missing out. And on the next slide, I want to make sure that you know about this resources that we have for advocacy in Spanish. We have a nuevo boletín en español, right? And so there's the website for you to be able to subscribe. Make sure that you click on that and become a defensor de los centros de salud. So now we'll go to almost to the last slide, but the next slide, please. I just want to say that on behalf of the National Association, les damos nuestras sinceras gracias por todo lo que hacen por nuestros campesinos. Son muy importantes que sigamos adelante, ¿verdad? Ayudándolos y apoyándonos. And then on the last slide, I want to make sure that you have our contact information, including mine, that's my email address, and my work number, that is my cell number, as well as if you have any questions for our policy staff or our advocacy staff, there's some emails. Estamos aquí para servir. Thank you for your time. And Seth, did I make it? Did I make it on time, Seth?
You did great, Rachel. Thank you so much for that wonderful presentation and great information. Sí se puede, ¿no?
Sí se puede, siempre se puede.
Siempre. So we do have a couple of questions. So the first, just with respect to what you had shared around mobilizing activities and being able to get folks to vote. What sorts of things are health centers allowed to do in terms of being able to work with populations? And do you have any examples that you could share of health centers that have led successful voter registration initiatives?
You know, we do, and that's a wonderful question. And first, let's start by saying that anything that we do along voter registration and even get out the vote has to be nonpartisan. You can't get around that, but that's okay. We can do a lot of those. We can do a lot within that parameter, right? So definitely nonpartisan. We have to be careful. Because we don't want to lose our nonprofit status, but it can be done. We have outreach staff in various health centers that are actually deputized to be able to help people register to vote. And that goes a long way. That's very, very helpful. And by the same token, during election time, they're able to just make calls and encourage people to get out the vote, right? So that is very simple to do. We do have some more tools and some more examples on our website, and we're happy to share more of those. So I encourage you to go there. But working in partnership with other nonprofit organizations that are going to have the same limitations, the same parameters that they have to work under, working in partnership also goes a long way.
Great. Thank you for that, Rachel. We have time for one more question. And there was a question that came in with respect to the workforce section and what you had shared there. And we also heard a little bit about this yesterday from Jim in his presentation, that there's funding for this new public health workforce. Is NAC engaged in any advocacy efforts around that funding, and in particular as it relates to opportunities for community health workers and promotoras, and to be able to grow that workforce?
You know, the community health workers are so key to our healthcare team. They're invaluable. And I love that this question was asked. It's also important to note that the administration is really using them to talk about that they are the best advocates for going out and dealing with the right information about the COVID vaccine, right? And all of that that's going on. So with that spotlight, yes, we are trying to push as hard as we can to make sure that they do talk about community health workers and how to help them get engaged from the Bureau's perspective, right? And so we're hoping that those things don't fall on deaf ears. It's also important for us to work with other partners to be able to help get the health workers, the community health workers, to a point where the promotores are going to be ready to go, right, whenever they're going to be called upon to do more than what they're doing now. So we are partnering with the National Association of Community Health Workers, as well as other entities that are out there, to be able to strengthen them and hopefully lend voice, also lift their voices to push for more things to be happening from the Bureau along those lines. So we haven't heard anything yet definite from the Bureau, but we are still connecting. And at every point that you as our members can have an opportunity to ask those questions and push that point, take advantage, because if they hear it from the field as much as they hear it from NAC, they're going to have to do something with it, right?
Excellent. Thank you for that, Rachel, and thank you again for your presentation and for all of the advocacy that you do on behalf of health centers and the migrant health movement. We're so appreciative of you and all of your efforts and all of your leadership. Thank you.
Well, you guys inspire me. You always inspire me, both you and Maribel, Seth, but those people that are on the front lines, which is our audience, they are what make this movement. So gracias por el honor de estar con ustedes. Buen día.
Gracias, Rachel. So with that, I will turn things back over to Maribel to introduce Maria.
Okay, mil gracias again, Rachel, for your energía y liderazgo. Okay, colegas, we have our amazing keynote, Maria Hinojosa, so get listos to fangirl with me un momento. We are going to have a facilitated Q&A right after Maria shares, so please type in all your juicy chisme, all your juicy questions in the chat, so we can ask Maria afterwards. So with that, I'm going to introduce our colega, Maria Hinojosa. She's an award-winning journalist with nearly a 30-year career, which includes reporting for various media outlets, including PBS, CBS, WNBC, CNN, NPR, and anchoring the Emmy award-winning talk show from WGBH, Maria Hinojosa, One-on-One. As a reporter who was the first Latina in many newsrooms, Maria Hinojosa dreamt of a space where she could create independent multimedia journalism that explores and gives a critical voice to the diverse American experience. She made that dream a reality in 2010 when she created Futuro Media, an independent nonprofit newsroom based in Harlem, with a mission to create multimedia content from a person of color, a POC perspective. Futuro does this in the service of empowering people to navigate the complexities of an increasingly diverse and connected world. Hinojosa was the first Latina to anchor a PBS Frontline report, Lost in Detention, which aired in October 2011, and was the first to explore abuse at immigrant detention facilities, garnering attention from Capitol Hill, as well as both the mainstream and Spanish language media. She is the author of 2 books and has won dozens of awards, including 4 Emmys, the John Chancellor Award, the Studs Circle Community Media Award, and 2 Robert F. Kennedy Awards, and the Edward R. Murrow Award for the Overseas Press Club, and the Ruben Salazar Lifetime Achievement Award from the National Association of Hispanic Journalists. Her new book, Once I Was You, a memoir of love and hate in a torn America, Hinojosa tells the story of immigration in America through her familia's experience and decades of reporting, painting an unflinching portrait of a country in crisis. Con orgullo and with great pride, with the energía from you all, I present to you our colega, Maria Hinojosa.
Hey, what? This is when I'd be walking out on stage and I'd be like, yes! And I'd be dancing and you all would be like, she dances too. And I'd be like, yes, I dance too. But instead, estoy descalza in my bedroom, converted studio, because we remain in quarantine. And thank you so much, Maribel. Thank you for calling me colega, because I really appreciate that. That means a lot to me, coming from the work that you're doing. I, in no way, compare anything that I do to what you do. So I just want to I'll do all respeto for the work that you do. And I love listening to Rachel going back. She was like, for 60 years. And I'm like, yeah. Because as I was thinking back to, preparing for this speech, and I was like, I'm very clear about events that politicized me as a child. So I was a Mexican immigrant kid growing up on the south side of Chicago in the 1960s, late 60s and 70s. And so I know, well, some of them are in Once I Was You. Aquí entre nos, don't tell anybody, don't publicize this, don't retweet it, but I'll share it with you. There is going to be a version of Once I Was You that is, let's just say, for a younger audience. So that's happening, but don't say that. But it's very exciting because it makes me kind of go back into memories and things that that really marked me as a young Mexicana growing up in the United States. And I'm saying that because, one, I want you to do that same kind of work, that kind of historical memory, because what we're all living through and what you are doing is historic, will be written about in the history books, and you are the heroes and heroines of the picture. And the workers, of course. But I think a lot about how children are going to be impacted by what they're experiencing right now. And especially the children of our migrant workers. How are they perceiving what's happening? Of course, they're seeing all of this. Les está haciendo una impresión, obviously. Because the first moment that I became politicized in this country, the first one that I remember, was when I must have been maybe 6 or 7. There was no internet, so there was no 24-hour news cable, there was no Instagram, no Twitter, no nada. And still, I knew enough that this guy who was running for office named George Wallace, who was a racist, he's the one who said segregation today, segregation yesterday, segregation forever. And he was running for office, and I remember I was with my little Jewish girlfriend, and we were like, where are we going to hide? What basement are we going to hide in? Which is reminiscent to Anne Frank, people hiding in basements. Of course, I didn't even know that. There's a connection that I'll come back to, so I'll come back to that. And then it was Martin Luther King, obviously. As you were reading the awards, Maribel, which, by the way, I hate when people, I'm like, no, stop reading all the, because, it's a body of work, and I'm you. I'm not anybody special. I'm not superhuman. I'm glad I won all of those awards, but not if it distances me from people. But it is, to have won 2 Robert F. Kennedy Awards, who was so committed to the farm workers and to Dolores and the trauma that Dolores Huerta lives with, having been right there when Robert F. Kennedy was shot. So I appreciate the mention of that award. So it was George Wallace, racism. It was Martin Luther King and understanding my relationship to Black struggle for justice as the other. And then it was the farm workers. That was the most politicizing moment in my life. Because actually with the farm workers, what ended up happening is that, we took it very personally. O sea, eso de que boycott. Oh, forever. I mean, I started eating grapes after, I double checked it, and after I had kids. So maybe about 20 years ago. The boycott was real. The politicization, the awareness of Cesar, of Dolores. And as I thought about this, as I was preparing this speech, I was like, the thing is that I understood that there was a level of injustice on both sides of the border. If you are a farm worker, there is a level of injustice and invisibility. And before I talk about invisibility, I just want to give a shout out again to all of you, because y'all do the work. So thank you for being on the front lines. I cannot thank you enough. This has been the hardest time for me as a journalist, because I haven't left to go report, because my family doesn't want me to, and I have to respect that, even though my husband and I are survivors of COVID. But I'm getting the second shot soon, so I'm going to be out as soon as I can. I'll talk to Fauci, see what he says, who, by the way, cried the day I interviewed him, because it was that morning that mi primo, my cousin Gerardo se murió de COVID in Mexico. And Dr. Fauci here still was able to shed a tear for mi primo Gerardo, que en paz descanse, from COVID. So there's humanity that we have to remain in touch with. And I just want to give a shout out to, I have met so many either farm workers or the children of farm workers who have ended up in college, who are like the baddest, most amazing students. But I feel very lucky to have met a couple of very famous former farm workers, including Dr. Alfredo Quiñones Hinojosa, who, as you know, was a farm worker at one point, undocumented, and he is now the head of neurosurgery at the Mayo Clinic. And as he says, con estas mismas manos that were picking the vegetables, he is now doing surgery on brains on a daily basis. Or Jose Hernandez, who became an astronaut after being a farm worker. And I think it was Jose, or both Jose and Alfredo, when I spoke to them. By the way, Alfredo is not related to me, Quiñones Hinojosa, but something that they said really impacted me and really changed for me the framing, and I want to share it with you. I know you already know this, but for me it was a moment when I asked about feeling invisible. And whether or not, because this is something that I lived with, and they were like, no, we didn't feel invisible. Actually, we had an extraordinary community. We had an extraordinary sense of community, of what we were doing, of why we did it. Of course, everybody wants better working conditions, but there was a pride in the work that was being done. And more than anything, there was una comunidad. And so, for me, this changed the narrative. I don't believe that people who work, who do migrant work in the farms are victims. Again, better working conditions, better pay. Yeah, but no. And I never want to see people who are working and with that love de la tierra, que I feel it. Even though I've never worked a day in my life picking anything. I'm so proud of myself now that I'm able to carry wood back and forth, because we have a little tiny cottage and we ended up, spending more time there because of the pandemic. And we use, I'm in charge of the fire. So, I'm so proud that I'm like stacking wood again. I'm like, I don't know how to, it's not what I do. I go boxing. And so, when I went to Washington State in Yakima, and I was talking to the farm workers there, and they were talking about how the whole family would wake up, this all, 3 a.m, go drive into the fields, the whole family, turn on the car lights so that you can see what you're picking, pick all morning until the kids go to school, eat all together in the back, have mom and dad wake you up. O sea, the way in which, and I'm not trying to romanticize this, but I was just like, wow, man, this is family. This is the essence of the American family that this country likes to propose, that it has. In fact, son ustedes on the front lines who are doing that work, that representative of the family who, wow, mis respetos, that your children wake up with you and go to work with you and accompany you, and that you find through all of it a sense of tremendous amount of love. So let's correct the narrative. Right? Now, what we have lived through, all of us, this has been, first of all, we lost a lot of people, right? Tomorrow, March 24th, marks the first death of COVID in my house. It happened to a friend of ours in the Dominican Republic. So tomorrow is, tomorrow will be the 1-year anniversary of when I got sick, when I could not get out of bed anymore. And so I want to be clear that we lost a lot of people. We lost a lot of people who should still be here. And that's the that's the hard part, right? Just that's like, pero por qué? And like you, I'll wake up in the mornings, I have my ofrenda, my altar, and I'll just early in the morning and I'll just, be in tears. It's like, but how is this possible? And then we pick ourselves up and we go do this work, right? Because we have our common humanity. I heard that theme come up in what Rachel was talking about, and Maribel, our common humanity, right? So what I want to say is that we are stronger than we think, right? We are much stronger than we think to have survived this. I think about how we were pandemic babies a year ago. I was like, bueno, all right, well, if I have to stay indoors until August, okay. August, here we are. And we're lucky now because there's a vaccine. And we're lucky because people believed in democracy and went to vote. To me, this is, yes, there's no way you can compare this administration from the previous, but that doesn't change anything in terms of our role as a journalist and you as frontline to advocate for justice in our country. And so surviving COVID, surviving the pandemic, surviving the attacks under a previous administration, we lost a lot of people, but we have survived this and we are stronger than we think. The unimaginable is happening again. And the thing is that I always try to put it into context. So they have been taking children from us since forever. Let's just do a quick little history lesson, okay? And you can read about this in Once I Was You. It's part of the spinach in Once I Was You, I like to say it, but it's like delicious spinach because it was freshly picked, and now we have it with garlic and lemon and salsita and olive oil. That's in the book. And the thing is that what we have to realize is that there are so many connections, right? Yeah, I'm a Mexican immigrant. My story is out of being a Mexican immigrant. Yes, Mexican immigration is central to the conversation, but who were the first people by law that were excluded from coming to this country? Not excluded from participating in the democracy, but excluded from coming? It was Chinese Asian women by law. What were we told about them? That they were sex workers, and that's why they couldn't come, because they were going to bring bad things into this country. After that, it was the Chinese Exclusion Act. But you know what I realized? I was like, wow, eso fue mi mamá. That was my mom who was coming to be reunited with my father. So let's make the connections, right? If we are taught history correctly in this country, we know that the first language beyond the indigenous languages that were spoken here was what? Español. But we don't learn this in the history books. The first people to come from Europe to here actually landed in St. Augustine in southern Florida. And the second encampment was Santa Fe, New Mexico, before Jamestown and the Plymouths and Plymouth Rock and the Pilgrims. Now we know that the first sin was slavery, but the original sin was genocide. And so anti-indigenous hatred, anti-black hatred, anti-immigrant hatred, anti-Latino hatred, and anti-immigrant hatred is anti-humanity because immigrants are from everywhere. It's true right now the conversation really centers around, because we'll talk about the border in a second, but well, okay, I just went there. So, because what's happening at the border obviously is refugees, children. We're trying to correct the narrative, and it's very hard because people, ya no me lo pueden decir, right? Because I've been doing this for a while, but it's like, ay de Maria, she gets so close to the story. And I'm like, you're right, I'm close to the story, because you know what? I remember Rachel saying you had to be nonpartisan. That's good, because guess what? The Republicans and the Democrats have been responsible for horrible immigration policies in our country. It's ugly. And so what does that mean? That means that we have to take more responsibility for our awareness of democracy. I'm so glad that people came out to vote last time around, because we were on the road to tipping into full fascism and authoritarianism. We were there. You've all lived through that fear. We all lived through the last 4 years of fear. It's different now. But sadly, the narrative hasn't changed. So we went from a kind of invisibility to a hyper visibility. But that hyper visibility is an incorrect narrative. So now we have to go and correct the narrative after being invisible. Óyeme, it's a lot of work. And I want to tell you that, I don't stop. I don't stop because I feel like this is a historic. I feel like it's a pressure on my shoulders. Maybe it's one of the reasons why I go boxing every day, because I feel like I'm boxing with the weight of history that is trying to portray us in a way that is incorrect. Y no lo voy a permitir. Why? So here is what I hope that part of what my message to you is that, there is a tremendous amount of shame in this country for owning our stories and our history. And that is, I think, why you've invited me here and why my work is recognized, is because I do uplift our stories in journalism. But there is so much shame. There's so much shame. And these are American stories. And yeah, there's shame there because in this country, the policies have not been on our side. So I now, as a professor, well, because you all know I'm Mexican, I have 16 jobs. So I'm a journalist, I have a company, I wrote a book, I'm an author, I'm a public speaker, and I'm also a professor because I'm Mexican. I have 16 jobs. Of course, I never say no to work. And so I have students who are now writing about the experience of having their mother taken away from them by ICE because they're old enough to remember. Because this has been going on intensely since 9/11. Now, children have been coming to this country without parents because they're refugees. The first time we heard about this was Elian Gonzalez. Remember? You're like, Elian Gonzalez, okay, you'll go back. So when I went to report about Elian Gonzalez for CNN at the time in the late 1990s, at that point, we understood that the numbers of children who were coming to this country sin acompañamiento, o sea, niños, vulnerable children, was always on the increase. So yes, this administration should have been prepared. But you know what? As I pointed on my Twitter this morning, I said, please remember that these are children. They are refugees. They are desperate. They are terrified. They are vulnerable. Think of them as your children. And I said, by the way, there are not 500,000 of them. There's a few thousand. And you can't say, protect the dreamers now, and say, but not them. There are dreamers now. I know I went overboard on MSNBC on Saturday morning when I said to Joe Biden, I was like, you should go down there and be welcoming them. You should say, I see you, that compassion I have for my grandchildren, I see you. And don't tell me that there's not enough room in this country. You know, of course there is. So now we're charged with flipping the narrative. Again, in the question of the work that you do, it's flipping the narrative. Never before, or I guess in a kind of social media way, had we understood that the frontline workers, the work that you do as healthcare providers with the workers, saved us. For me here in New York a year ago, what it was like, oh my God, it's the South Bronx. which is, lleno de mexicanos, lleno de centroamericanos, full of black immigrants as well, and black people, and Corona queens. These were the epicenters of the epicenter. And a lot of it was people providing food. The workers in the delis who were still, the ones that could, right? Because they shut everything down, couldn't even get a slice of pizza. The subways were full, coming from the Bronx into Manhattan, coming from Queens into Manhattan, to keep the city working and fed with the fruits and vegetables that you saw, that you see. So I'm just gonna, seriously, I get all emotional. Oh my God, I get super emotional because actually food and my experience with COVID was really intense, because I would have these, ¿cómo se llaman? Deseos, cravings. And it's like, I need this. And I was sick. I got sick over the time that the city shut down. So I would say to mi querido esposo or my kids, I was like, I need this. And they'd be like, the city is shut down. And I was like, well, please go to the grocery store, make it for me. And they're like, you can't get into a grocery store. It takes an hour or two to wait. And I'm just like, ¿qué? And as soon as they could, the first thing I made when I felt better was huevos con chilaquiles. And I remember cooking, and I was so happy that I could eat and taste and enjoy. And then I fell asleep for 5 hours, because that's how it goes. But then when I was really getting better, I made una sopa de pollo estilo a mi abuelita. And I had my mom, and I was like, no, tell me. And it takes 24 hours, and I had to let the chicken sit and overnight y todo. So thank you. And one of the last places that I went before the shutdown was Central Mississippi, to see the people who work in the chicken processing plants so that I could have mi sopa de pollo. That was where they did the largest raid, the workplace raid in Mississippi. Almost 700 people, casi todos guatemaltecos y mexicanos, indígenas. And I thought, oh my God, if COVID gets here. And of course, it's in Mississippi. And they still go to work. And they never shut down the chicken processing plants because they were declared essential. And workers were sacrificed. So, for me, this is a moment that I'm encouraging you, again, thanking you, but I really do hope that you're making note of the work that you're doing, keeping a journal, keeping an audio journal. If you're too tired, even just, record yourself on voice memo. What was your day like? Digitally, it won't disappear, right? And that will be for your grandchildren, your great-grandchildren, to hear what you lived through. Even if it isn't, front page on the news that you are living and working in these conditions, we need to document this history for ourselves. Sin pena. And one of the things, there's many reasons why to do this, but one of the things that happened that I want to share with you about why I talked about, children kind of what they're feeling now, what they're experiencing now. Of course, they're taking it all in. They're feeling the fear, also the joy, because kids love to have a good time. So if I was on stage with you, what I would have done before is I would have told the story of my arrival to this country. And the way I would have told it previous to the year 2018 was that I would have said, no, mi mamá comes to meet my father in Chicago. Mi papá, que en paz descanse, was a medical doctor, a researcher, genius, helped to create the cochlear implant to help people who are deaf who want to hear again, from Tampico. And so we were meeting mi papá. We came by plane from Mexico City to Dallas, changed planes in Dallas, and then went to Chicago, 1962. And we had green cards, so we had privilege. We had privilege. And the way I usually would have told the story is that mi mamá se enfrenta. My mom has this moment with the immigration agent, and my mom speaks back to the immigration agent, and my mom is like the hero of the picture. When that audio tape dropped from ProPublica, where we heard the screams of the children, who are, by the way, are screaming and crying right now, today, the refugee children who have been taken from their parents, they are screaming and crying right now. We're not hearing them. But when that happened, I was in an airport, and because I used to live in airports, not anymore, and my mom called me. And my mom said, oh my God, and she was crying. I was like, ¿Qué pasa, ma? ¿Qué pasa? Ay, mijita. Oh my God, it could have been you. I'm like, what are you talking about? What's happening now? The mothers whose babies were taken from them, it could have been me. And I was like, no entiendo, ma. What are you talking about? I know that you're feeling emotional. We all are. And she was like, no. What happened at the airport in Dallas, Texas, when we arrived, was that the immigration agent actually wanted to take you. And I said, ¿Qué? The agent wanted to take me. And in that moment, my mom basically goes into fight or flight and starts screaming at the top of her lungs at 5 feet tall, screaming back at the immigration agent that he will not take my child. When I understood, like, oh my God, eso fue lo que pasó. Oh my God, my mom, she was like, I went into a place of trauma. In that moment, I was like, now I understand why I do what I do. I'm a journalist who will report about anything. I mean, I have been to war zones. I have covered protests. I have covered, any issue, I have covered it. And I'm glad that I'm a journalist who can do so much, politics and all. But the one issue that has been at the heart is immigration. And when my mom told me that story, I understood why. Because that kind of trauma seeps into you. It seeps into you. And that seeping right now is happening a lot in our country. And I know you know it. I know you see it. And I'm not sure, I mean, you're the medical professionals, and you're the ones who are having to answer this question, especially around mental health, right? Especially around the fear around COVID. But the mental health challenge is real. Fear, By the way, we have to talk about the fear of the vaccine too. Look, I had COVID. I'm super smart and all, but I was scared of getting the vaccine. If you follow me on Twitter, I was like, tengo miedo. And after I got the shot, I was like, I'm very emotional. I can't stop crying. I couldn't stop crying, And we did a show on our politics podcast called In the Thick, where we talked about it's legitimate to have fear. It's legitimate to have apprehension. It's legitimate to say, ay, pero qué? So that doesn't mean that it prohibits you from ultimately doing what we have to do, because, it's a group effort. The more of us who get the vaccine, the faster this goes away. So it's really a group effort. And so I'm not afraid to talk about my fears and to share them with you, in the same way that I'm not afraid to talk about the mental health challenges that I've experienced or continue to experience. One of the things that really connected in the book was me talking about the imposter syndrome, and kind of how, as a Latina, I always kind of was like, do I belong here? Do I? And actually, yeah, we belong here, but a lot of it comes from our invisibility, right? Our sense of invisibility. And that's why I'm so happy that you have this conference, and that, as Rachel says, for 60 years you've been working on this, and it's not perfect, but we absolutely need you. all of you are part of changing this country's history. And it's not going to happen. I mean, who else is going to do it? That's where I feel this direct responsibility. And when I understood as a journalist, I was like, oh, my founding father is Frederick Douglass. Ida B. Wells, Frederick Douglass, who was born into slavery and then launches a newspaper. Ida B. Wells, also born into slavery, who becomes an investigative journalist. Ruben Salazar, working at the LA Times, who is murdered for doing his work. So then I understand, oh, I'm part of this country's history as a journalist of conscience. A journalist who won't be silenced. And that is also a part of my journalistic tradition from Mexico. Periodismo un periodismo contestatario that I also learned in the Mexican tradition and that I maintain and are very present now. So I'm going to open it up for questions in just a minute, but I do want to take a moment to kind of center what's happening right now. Hate crimes against Latinos and Latinas and immigrants have been on the rise over the last 5 years. We have been waving the red flag and saying the canaries are dying, and we've been told to calm down. So hate crimes against Asian Americans, of course, we're just living through it. But we have to recognize that history of exclusion. And we have to identify our common history, the Filipino workers, the migrant workers who are organizing alongside, right? So I also want to empower you. When I created Futuro Media 11 years ago, Futuro Media didn't exist. I wasn't sure what I was doing. Y me lancé. And I want to encourage all of you not only to keep this organization and the work that you do alive, but to support the creation of other organizations that are coming from the grassroots, that are giving voice to the next generation. Because we need to hear your voices. We need to hear your stories. I cannot tell you how much I'm dependent on you to tell me what's happening. So yes, I appreciate being la vocera, but I'm nothing without you. So stay in touch. Now we can conversar, as we say. Pero find me. As soon as I get the second shot, I'm already, okay, to be honest with you, voy para la frontera. I have to go to the border. I have to go back to Tapachula, the border with Guatemala. And then I think I have to go to Honduras. I just want to understand, even though it's an incredibly dangerous place. But and then I promise to come visit you if I get an invitation. So thank you so much. Thank you for your important work. You are not invisible to me. You are our heroes and heroines, and please document your history, share your stories. Yours are essential American stories documenting an essential moment of survival in our country where you were the saviors of the picture. So thank you so much. Muchas gracias. You all are funny.
Party of two. Actually, a party of hundreds of colegas are streaming in right now, and they are sending us their preguntas. Muchísimas gracias, Maria, first of all, for your truth speaking and for centering our historias, even when people don't want to hear them. So, gracias for that. Okay, colegas, submit your questions. We have a couple. Maria, voy a comenzar with the first one. It's from our colega Jonathan. I will display it. You're an inspiration. Muchísimas gracias. The question is around, now that I approved it, I don't know where it went. But the question was around COVID vaccine access and messaging. So can you speak a little bit more about what are ways that our colegas could be working or massaging their messaging around COVID vaccines?
Look, I mean, I'm not an expert in public health messaging, so I'm like, what I know is being very honest. I mean, that's how I operate. That's why I point people to listen to the last couple of episodes of In the Thick, where we were talking about grieving and how do we kind of work through the sadness of this moment. But then we were talking about the vaccine in another one. We were talking about, vaccine hesitancy. And just this weekend, I was in Connecticut, where our little tiny cottages, which is, by the way, many farm workers in Connecticut, farm worker families, and la señora que was doing the manicure, because now I don't do a manicure here in New York, it's just too crowded. So Ecuatoriana, and we were talking, and she started saying all of these things, and I was like, where are you getting this information? So the misinformation campaigns, specifically around vaccination, there is a lot of money to be made for misinforming our people. And I think we need to kind of put that in our minds, like, wow, why are people doing this? Because they're getting paid to do this. Entonces, talk about double sourcing or even triple sourcing. So what is a credible news source? Let's just say, is it Univision and public radio? Your local public radio? Okay. Go and look on their websites to look for the information that you are saying. In this case, she was saying, no, the vaccine is going to cause infertility. And I'm like, but where? Now, okay, to be honest with you, okay, yeah, it's true. It's a new vaccine. We don't have all the information. But as I'm going to be very honest with you, not able to have kids versus being dead. I'm sorry, pero tengo que pensar en mi primo Gerardo. Gerardo, a year ago, thought he was going to be alive. He's not here. So, and I think other messaging has to be, te comprendo, te entiendo, dime lo que sientes. When I went to get the shot, my daughter, by the way, I was so apprehensive about it all that I told my daughter, I was like, if you want it to happen, you're going to have to make it happen. Because I can't deal with going on the internet and dealing, like, I just can't. And so she woke up on Sunday at 5 a.m, went online, and she found appointments for later that day. And I was like, and there we were in the South Bronx, and I was crying and crying. She was with me. And the nurse, who was an immigrant from Ghana, Didi, saw me, and she spent time talking to me. And she said, this is your freedom shot. When I think of Harriet Tubman, I think of her freedom dreams, the capacity she had to dream of a country without slavery. And so I was like, a freedom shot, freedom dreams, liberation shot. And so I talk about it. And that's what we have to do. We have to share our stories, share our apprehensions, and not judge people. Walk with them.
Muchísimas gracias. All right, we have time for at least one more pregunta. A ver, you talked about, Maria, around the importance and power of owning and telling your story in digital access. So what is one piece of advice you would give to our compañeros, our colegas, around telling their story, owning their story?
Oh my God. I mean, so those of you who follow me know that I love Instagram. And I love Instagram because I feel like it's a way in which anyone can tell their story. Look, I don't like the fact that it's a conglomerate, that it's owned by Facebook, that, that there's a lot of ways in which they trade. I understand all of that. I'm just showing that for people who are able to tell their stories, I mean, that's one thing that I do to get very inspired, right? And I don't do TikTok, my daughter does, but I'm very inspired by this generation able to kind of document. I'm very inspired by the indigenous TikTok, actually inspires me a lot. And so there are there are different ways to tell your stories. That's why I was like, I don't know, record a voice memo, record yourself and put it on a file, write it down in a journal. If you haven't heard the podcast Suave, which we just dropped a couple of weeks ago, and it just wrapped up and it's getting a lot of attention. And I started recording my conversations with Suave in 1993. He was sentenced to life in prison without parole. He was going to die in prison. And I started recording those conversations. He knew this, and reporting about him. One up was he came out. And now we have a podcast that is like getting a lot of people excited because we were doing this over a period of time. So your stories are not migrant worker stories. They're not immigrant stories. They're not Latino and Latina stories. They are American stories of American history. Okay? And, ese término americano, I know it's complicated, because in Mexico somos norteamericanos, estadounidenses. It is correct. But for the context of this, hell yes, we're American. And these are American stories. And you have to listen to them. And I can't be quiet. I can't be silent any longer. Porque la verdad es de que, I'm getting on. Ya no soy tan jovencita, entonces I'm going to go out with a bang.
Love it. Oh my gosh. Do you hear the aplausos that are filling the virtual space?
I'm trying.
Okay, we do have time for a couple more preguntas. Oh, Maria, you're going to love this one. Okay, this is from our colega. From our colegas in Wenatchee, and you mentioned Washington. So it's in Wenatchee, a small rural town in Washington. We are collecting farm worker stories. How can we support farm workers who are afraid that there may be retaliation if they speak up? This one is really common. We've been hearing it around, Maria.
Look, this is very difficult, right? Again, because, I understand what these experiences are like on the ground, and it's very hard for me to be from the security of my apartment in Harlem to say, well, do this. Here's what I can tell you is that in terms of journalism, find your allies in the local media. Any local journalist who is really serious is going to appreciate having a source. And you are sources. And you're like, well, I'm not a politician from DC. I'm not a source. You are sources. So make the connections with your local journalists, those of you who can, and find ways again to document the stories. Look, I'm always looking for stories. So again, I'm not that hard to find. You do have to kind of push, right? Because we're all busy, and not every story is a national story. You have to remember, like I do national stories. I have to have kind of a national, but find your local journalists, find investigative journalists. And if in particular you have stories that have to do with H2A, I'm actually doing research about that. So please get in touch with me. Because that is, and you don't have to publicize that, but I am doing work around H2A. So if you have stories, if you have whistleblowers, if you have something that I need to know, find me, please. It's very simple, by the way. It's maria@latinousa.org. Real simple. maria@latinousa.org. You need to be safe. But also, leadership is scary.
Mm-hmm.
Leadership is scary. Everything is risky. And many of us are putting our lives on the line to either complain, to point out injustice. And I applaud people who have that capacity. But mostly, we need to be safe right now.
Muchísimas gracias, Maria. And this question actually speaks right to that también. So it says, thank you for inspiring messages. How do you address persons in power who consistently want you to suppress your story, culture, and just do the work? What are your 3 things that employers need to know to be more culturally sensitive and humble? So kind of a 2-parter.
All right. Well, let's see. Employers need to, and I'm an employer, right? I mean, I also have a relationship where I have staff now. And so the creating a culture within the company of openness, how do you do that in this context? You keep trying. And you basically, I mean, in this context of, let's say, farm workers, it really comes down to the bottom line. In many ways, they won't understand anything unless it impacts the bottom line. And morale affects the bottom line. So it's so hard for me. I'm struggling because I'm like, I don't even know how to kind of frame it. But to me, within the work experience, it's cultural competency. It is having a way in which employees can voice their concern. That is not, because my employees can't just come and, Maria, you have to have HR, you have to have a process. And I would say to the employers, you better have humility. And I think that's what this generation is teaching us. I know that sometimes I'm like, wow, this generation, they don't settle for anything. And I'm like, that's okay. Like when I compare it to what I had to live through. On the other hand, I kind of appreciate we're not going to let it down. Mm-hmm. And that requires those of us who are employers to be more humble in the process. And I can't remember the first part of the question.
Yes, the other part is what are the 3 things? Oh, the first part was, what do you do if an employer is trying to suppress part of your story or your cultura? How do you navigate that?
It's always easier to find a job when you have a job. Mm. So if you can, look for another job. Also, try not to be the only one. Form that collective, right? Where por lo menos you can desahogarte with other people, because you're going to need to do that. These issues of labor, I mean, your labor rights, right? I mean, that's part of what we're trying to stretch. We're all over the last 60 years is to have your rights defended. So, form that collective. Don't try not to be alone, because you are not the only one. You're not the only one.
Gracias, Maria. We have time for maybe 1 or 2 other questions. This one just came in, so I'm gonna read it because it just came up here. How do you combat the perspective that some folks may have on diminishing resources? That as immigrants come to the country, they are taking resources away, or Latinx and people of color advance, or taking resources away from other communities?
Well, facts. That's the best, I mean, it's hard because people are going, but let's just take the state of Texas, okay, which is not like a progressive state. But the GAO of the state of Texas basically said immigrants of every sort are a net win economically for the state of Texas. That's just one example. What we know is that when there was the last massive legalization in 1986 with Ronald Reagan, that massive legalization of immigrants helped lift the country out of a recession. That increased employees across the board means more consumer spending, which uplifts the American economy. Where if I was a politician, right, and I'm not, I know the ad that I would have created. It would have been with Joe the plumber in the middle. I'm sorry, Joe the plumber and Joe the plumber black guy. So a white Joe the plumber, black Joe the plumber, and in the middle, Mexican dude or Central American dude. And both of these guys are saying legalize him so that my personal economy goes up. Because if you legalize him, he can now buy a house, buy a car. He's got money. He's going to send the kids to college. Oh my God. Now you begin to see he just increased economic movement. And also, you can have examples where, having the entry level, okay, let's just talk about people who are now coming in, refugees, right, who are going to be happy to work at all. That allows you to then move up in the job ladder. There's always a way of framing this from the glass half empty or the glass half full. And what we know historically by data, by the way, if immigrants had been a drain on this economy, then the United States would have been in a permanent recession for the last 60 years, to take Rachel's number. Okay? That's just, if immigrants were such a drain on this economy would not have been able to grow. Facts. Show people also, the people who live around them, when you're talking with them, you're threatened by this person? Really? Why? I've traveled to every state in the union. Óyeme, por favor, hay mucho lugar. If you took, 50,000 refugees, Central American refugees, Syrian refugees, right, and you put them together in the middle of Oklahoma, it's going to be the coolest place to hang out in a matter of years. But the narrative is that they are takers, and we have to say, no. They're the ones we want in this country. They're the ones we want. They want to come. Porque a propósito, let's make it clear. Not everybody wants to come to this country. Not everybody wants to come. Please.
I want to end it on that note, pero we have more time. Well, we have a request coming in, Maria, and this request is from one of our colegas that say, Maria, help us make a national story on CNN about the work that NAC, NCFH, NWRPCA, and all of our community health centers and community-based organizations are doing with our comunidades. These organizations need to be part of the experts list and need to be featured more often.
Well, yeah. So this is your work to do. Of course, I'm going to help you. I'm going to report. I'm speaking with you. But I want you to know that this is the work. For example, I have many platforms, right? I have Latino USA. I have In the Thick. I have my book, Once I Was You. I do public speaking. But I'm not a paid contributor to MSNBC, which is one channel, right? It's not CNN. It's not. I have to work to get there. This morning early, I sent many of the producers a copy of the tweet that I put out, which was, let's remember that these children are refugees. I have to push so that they'll invite me to talk about this issue. And I'm like, Óyeme, María, por favor, you've been around a while. Have a little bit of self-respect. And I'm like, yeah, but you know what? No puedo ceder el espacio. I can't cede the space if I'm able to try to correct and place this narrative correctly.
Sí.
So you have to do the same thing.
Sí.
It is kind of constant. It is part of your work. It is finding the journalists. It's establishing relationship with those journalists. Thank you for inviting me. Not every story is a yes. So if a journalist doesn't pick up the first story, don't be just like, okay, forget it. Again, go out for coffee. Well, when we can, call them up, tell them what's going on. It takes a while for you, right, to understand how you pitch correctly. But the most important thing is to form relationships with journalists nationally and locally to try to get your stories out, and don't stop. It's not quick. It can take years. It can take years.
Muchísimas gracias, Maria. We're going to have to send you all of the amazing comentarios that are coming in. There's so many comments of praise. So we'll send them to you porque we are so agradecidos you're here with us today. Colegas, Maria, I have a special request.
Yes.
Can someone please screenshot us together? Look at how good we look. We'll do some selfies. Luego. Okay, muchísimas gracias, Maria. We're sending you all the virtual celebración and and aprecio and abrazotes. So muchísimas gracias from us. And there's hundreds of colegas right now that are live streaming. Así es que muchísimas gracias.
At the end, here's my last thing.
Dinos.
If you have family, friends, kids, primos, tías, who want to be journalists as well, por favor. You can do it, and we need you. We need you. I need you because I need to eat healthy, and thankfully I'm able to do that, and you keep our farm workers healthy. So thank you so much. But also, you too can be a journalist. No es nada del otro mundo. And we need you documenting your story. So muchas gracias por darme este honor. Honestly, I wish I could like virtual hug, because I love these. I mean, these are like my favorite conferences. Like, this is seriously like, I would be just like staying late, hugging, selfie. I'm that. So as soon as I can get out of this house and put some shoes on, let's do it. I promise to come and see you, and we'll do this again, okay?
Have música y margaritas.
Oh,
We'll send you in contact.
I like that.
Cuídate, María. Gracias.